Hello, and welcome to Connecting Hawaii Business on ThinkTech Hawaii. My name is Kathleen Lee, owner of Kathleen Lee Consulting, and I am your host for this program. We are currently live streamed on thinktechhawaii.com as well as on ThinkTech's Facebook and YouTube pages. And viewers like you have the opportunity to ask us questions during the show by emailing questions at thinktechhawaii.com. And I do want to thank the Entrepreneurs Sandbox for having their free co-working day. I'm in one of their private booths this afternoon, so thank you, Sandbox. On the show today, we will be discussing business and public health and how community health affects business and everything else around us. There's the stutter. I was waiting for it. My guest on the show is my friend, Dr. Camonia Graham-Tutt. She's an assistant professor of community health for UH West Oahu in Kapolei. Hey, Camonia, welcome to the show.
Hi, Kathleen. I'm so happy to be here. Thanks for having me on.
And thank you for being here. For our viewers, Camonia and I met through the Young Professionals Program Mentor Hawaii cohort. So she and I are in that this year as mentees. Very awesome. And tell us a bit about yourself.
Where do I begin? I consider myself a local gal now. I've been here in Hawaii for 10 years in August. I'll have to figure out a way to celebrate that. That's COVID safe. But as of 2011, I moved here for a postdoc position at the University of Manoa. And I did that postdoc position for approximately 3 years. It was a 2-year fellowship. And I luckily was asked, can I stay on for an additional year? It came at an awesome, perfect time for me to get a lot more information and learn more about health, young individuals in health, and populations here. And so I really am thankful for even just having that opportunity to come and then to stay. And so after that time at the University of Hawaii, their public health studies office at the time, I also was able to work at the Cancer Center. So I've been able to spend some time at UH Cancer Center, still doing health promotion work. And now I'm so thrilled to be over at UH West Oahu. So I often joke that I've had like kind of a lay of the land when it comes to the campuses at UH Manoa and in the UH system. So I'm really happy to be here. Thanks, Kathleen.
Yeah, and I'm sure you've um, made an impact already with your students and the community. So let's go over your area of focus. What is public health? For those who, I think I talked to you before. I mentioned to you before the interview that some people think that public health is like it could be like a medical thing, or like what is public health?
Well, yeah. And what's so special about, how we've kind of coined our concentration area over at West Oahu is that it's definitely public health, but it's more so community health. And really, community health is a branch of public health that truly focuses on the people in the community and their role as like determinants of their own health, in contrast with other individuals and their health. In another layer with the environment, which also focuses on that physical piece of the environment, meaning buildings and structures, and then how those things impact people's health. My students just love hearing about and learning about the concept of the social determinants of health, because those are the things that you encompass or come across in your everyday life that you don't even realize affect your health. You live in a neighborhood, maybe on the further tips of the island, and you notice, hey, those cars are really close to those individuals walking to the bus stop. Well, how does that impact somebody's ability to maintain their health? How does it impact that person's ability to get to work? Maybe they're afraid that a car is going to hit them on their way to walking to the bus stop, all because there's no sidewalk that's available. Those are some of the really, really interesting things that help students to, and really our society to understand the health of your community is not only your own individual onus or impact, but all of us together. So I like to consider community health as definitely somewhere where we think about how do we live, how do we work, and how do we play together in a place that's healthy.
And thank you for explaining that, Camonia. Why did you choose this particular field to study and to teach?
With my, albeit maybe not even long history, I felt a calling to want to help the individuals help themselves. And so that's kind of a common thread throughout why I'm close to community health and why I'm a professor at the university. I've always had a passion for teaching someone to then be able to teach others, or then to use that knowledge to then help themselves in their daily lives. So I'm originally from Texas. I graduated from a predominantly African American high school in Houston, Texas. And from there, I went on to Baylor University. And while at Baylor University, I initially, many of my students don't know, I was a pre med student. And in that time of being a pre med student, the classes were fair. But I do think I might have been kind of an influence to say, do you really want to be a doctor? Do you really want to help the community? And at that time, maybe I was asked to choose. And so I chose the route to become an educator of communities regarding health. So at the time I did, health education work. I remember doing 2 internships because I was still unsure. I did an internship in physical therapy, and I really didn't care for that, scrub life, or that uniform life. I have a lot of personality. And so I wanted to move into something where I could help people see who I was and also see how what I was sharing was valuable to them. So I remember doing an internship with Hillcrest Hospital at the time, and I was very animated. I still wore the scrubs, colorful scrubs at that. And I had a badge, and I would go into patients' rooms and ask them, while you're waiting on your care, how about we talk a little bit about breast cancer or breast health and how you can make sure you're understanding your screenings. And so it was a really great way to kind of like launch me into a field of community health that I didn't even know was happening.
I love that. And so now you're focused on teaching undergraduate research. Is that correct?
Absolutely.
So we have
So,
like in your background, you have the graphic for the UH West Oahu Student Research and Creative Works Virtual Symposium, which you have organized for the last 4 academic years. So could we pull up that graphic? And Camonia, could you go over how this came about, what your role is, and how you are teaching your students through this symposium?
sure thing. Um, Again, goes your life kind of goes full circle. I know a lot of people don't think about, these things that keep popping up in their lives. Well, research was an area that just kept popping up for me. While as an undergraduate student, I studied hard. I would, skip things with my friends in order to make sure I made the appropriate grades. But I was never really asked about research opportunities. I didn't really even know to ask. I knew to go to class, make the grades. And so, fast forward to my master's degree, which was also at Baylor, I got asked. Someone asked me, I have a research project. I need a student to work on it. I kind of slipped my hand up, being the student in the right place in the right time. And I said, oh, I don't have a problem working in Dallas, doing a little bit of community health work with the population on cardiovascular health, helping them, as I said before, learn how to help themselves. It was a community that I worked with. They wanted to understand, how do we mitigate cardiovascular disease? Well, we create ambassadors for information. And so I helped with teaching those community members to have their own kind of program where they would educate their own community members about community health. And from there, it kept going. So that little piece of research then took me on to say, well, I'm not done with my education. I'll go to Howard University. I attended the Howard University, got so much experience from all of the individuals there, my mentors. Shout out to Dr. Florence Bonner, everyone in the sociology department, all the way up to the administration, was very integral in providing opportunities for me to continue research. And so upon moving to Hawaii, after teaching a little bit at the University of Texas, Arlington, I saw, oh, this research thing works for me. Why don't I continue it? And then getting to West Oahu, my first semester there, I thought that my students deserved a larger platform to present the hard work they had been working on all semester. So back in 2016, I said, what the heck? Let's try to catapult you guys. They came to the first symposium with all of their fancy attire and maybe some slippers there as well. And the students were just so proud of themselves. And so I said, aha, there goes that moment again where I'm helping someone to realize that they can use their education to propel themselves and to be confident. And so it really just started because I wanted my students to be able to share the awesome work they had done to more than just me in a classroom environment for 16 weeks, right?
So I thought and this is good that you clarified that. I know I mentioned that you led it. I did not realize until now that you started it, which is absolutely awesome. How has that symposium pivoted since COVID-19? I'm guessing it started out as an in-person event with your students and people in the field coming into a venue that you selected. And how was last year different? That's the graphic that we have behind you.
So,
Kathleen, this year and last year, right?
Yeah, Kathleen, it's pretty awesome because as a faculty member, you don't consider yourself having a business, right? But as a faculty member, I very much consider the Student Research Symposium a business. And so having this business during COVID-19, as every other business has had to do, we shifted, we pivoted. I listened to a great conversation by the chamber earlier today about women in business. And I said, oh, I think I'm a business owner. I have a research symposium for my campus. And during COVID-19, I thought, what a disservice it would be to the students who are now at home, still doing research. What a disservice it would be to them to not be able to still continue to showcase the great work that they're doing. Well, luckily, we have Zoom as a platform. So we shifted everything that we did in person, you're right, in person with food and activities, we shifted it online. Meanwhile, the food might have been at your own home, but the students were able to join via Zoom in different sections throughout the day to present their work. And we still, as a matter of fact, we've had an even greater boost in our number of participants and individuals attending because of the accessibility of now using the Zoom platform. And so it's really great to say we've had over 1,400 people to attend in the 4 years, but now we've increased to over 256 people online attending a showcase of student research.
That's amazing. And to your point, I did notice that too, especially with because I'm on my neighborhood board, and I've noticed that the attendance has increased because of the accessibility that Zoom and video conferencing brings into communities. So thank you for pointing that out.
Yeah.
On that note, we are going to go on break, but when we come back, I would love for you to go over how you are part of the COVID-19 contact tracing training program for the state. So that is something to look forward to after the break. We will be right back. Welcome back to Connecting Hawaii Business. My name is Kathleen Lee, and on the show today we have Dr. Camonia Graham-Tutt, Assistant Professor of Community Health at UH West Oahu in Kapolei. So, right before we left off, I mentioned that you are the co-lead for the COVID-19 contact tracing and training program in Hawaii. Tell us more about that. And how did that even come about? Obviously, COVID-19 is going on, but let's ask you, how did that come about in your radar?
So if I have to think back, I'm very fortunate. I guess I exhibit myself to be a willing worker. And so I get emails oftentimes to say, we're doing this project and we need you. And so for that, I feel humbled, right? Because faculty colleagues are asking, for assistance, and I'm really always welcome to help. And so that's just what happened. A very dear colleague, Dr. Rick Custodio out there, he said, "Hey, Camonia, we've been called, we've been chosen, it's time." And so I've put together courses in the community health program at UH West Oahu that are centered on helping students to understand concepts like theory, human and health behavior. Why is it that individuals react the way that they do regarding behaviors and health? Why does someone continue to eat the things that are maybe not as good for them and they have diabetes and things like that? So one of the courses that I created was hand selected to be a part of a contact tracing training program with the UH system, with our Department of Health, and with luckily UH West Oahu. So attached to the class was obviously me. And so we put together this program where students would take two classes dealing with health behavior, human behavior, how individuals will react to understanding diagnoses, and also really current health events. And so that class that was selected for me was Public Administration 368, Foundations in Community Health and Health Behavior. So that started in June of 2020. And when I tell you it was a roller coaster ride to be on, given that we were in the thick of the pandemic, we had to really adjust and build the plane so as we were going. And I really enjoyed that. So that's really how it came about.
What have you learned from that experience, that contact tracing training experience?
Wow, that's a huge question, Kathleen. I'll take your maybe this answer from the educational standpoint. It has been a very rewarding experience to teach traditional undergraduate students who may be first year for their family to go to college, who may be returning to college, or who may be even in our military communities. But teaching contact tracers took me out of that environment. I was able to interact with students who had been in the health field for 20 plus years, who had never been into the health field and were curious and wanted to help our state. I've also been able to interact with individuals who lost their jobs during the pandemic, and in a way to improve their skill sets and maybe even find financial support, joined our cohort. So it was a joy to teach the average individual and then to share with them, you are capable of attending and completing a college course, really just warmed my heart, because I was able to work with students who maybe didn't have the confidence, or maybe said, "Oh, Dr. C, I went to school 20 years ago and I kind of failed out. How do I move forward? I'm interested in not only an undergraduate degree, completing my undergraduate degree, but I'm also interested in continuing on." What's been fabulous is we've had a really great working relationship with our partners over at UH School of Public Health. And we've been able to help students move up from undergrad to say, "Hey, I like this public health, community health thing. I want to continue my education. I am," which is another piece, "I'm the voice of my community as it relates to health." It was such a joy to teach individuals who live, work, and play, which is kind of the context of community health. They live, work, and play in these areas, and they can then turn around and share with their neighbors, with their grocery store attendants, with their school attendants about contact tracing, that it won't hurt you, that it's built to help our state stay safe and healthy. Was such an awesome experience. I I really can't put it into words how it felt to then pivot a class from teaching during the day to teaching in the evening to then also teaching on the weekends to support individuals in our state in gaining an education. It was just memorable.
Let's tie this in. I know you covered it, but I want you to go into this a little bit further. How does community health, public health, community health, how does community health affect business in Hawaii?
So really, we've all lived it, right? So the awesome experience that we have is we were in a place where our state was shut down and we were unable to get to some of the businesses that give us the things that we need. And so it's clear that COVID affected our businesses. Well, within that, we learned that in order to safely do things such as get back to where we need community health. We need preventative efforts. If no one knew before this what prevention meant, I hope they know now that wearing your mask, washing your hands, staying 6 feet away from other individuals is a form of prevention. So it was a COVID, while it was very difficult to navigate, is really a community health or a public health professional's dream because we got to get into every home and share the message of preventative health. And so for businesses, it's the same thing. In order to operate appropriately or safely, we need some preventative health measures. And I will share that we pivoted our contact tracing program to support businesses towards our later cohorts. Individuals who were already working in their spheres in community health, maybe as navigators, maybe as community health workers, were able to take our class to learn about those concepts of contact tracing that were integral to their business. So, for example, if you work in a community atmosphere, and if someone may have contracted or been in contact with someone who got COVID, you would want to have some protocols or some procedures available. Who better to do that than someone who has taken our course or set of courses in our contact training program? So we were able, I feel, to service our state by preparing individuals with the knowledge and education to keep their business, their customers, and individuals in our community safe.
Love that. And I know community starts at home. So, as an educator, and we talked about this before, how are you teaching your daughter about like what you do? Community health, public health, all that good stuff.
Well, my 7-year-old researcher definitely reiterates what's told. And so I sometimes call her the warden, and she'll say, we'll hop in the car and we're getting ready to go to school. And she'll say, Mommy, you don't have your mask on. And so a lot of that education in my home comes from modeling. So if I model it to my 7-year-old once, it's almost like she doesn't forget. And so then she will share. But we've had a really great opportunity to explore other areas of public health together. She's really into social distancing. She understands that. If anyone has it in their own home, our temperature gauges that are digital, we purchased one, and every day before we leave the house or while we're in the car, Mommy, we have to check our temperatures. If your temperature is too high, you need to stay home. COVID-19 is out there. And so I will share that prevention does start at home. If you're not someone who's going to outwardly teach your child about prevention, it's okay to model it. It's okay to have a small bottle of hand sanitizer in their car seat so that when they get in the car, they know, hey, we're going to hand sanitize, we're going to use wipes. It's a great field to be an advocate and a model for our younger generation.
For those out there that, um, after watching you today, may want to go into the field of public health or community health study, what advice would you like to share with them?
Well, of course, thanks for asking that. Of course, I would love for any individual who's listening who has an interest in helping your community to be engaged, to promote health, or even to do some community health action research, feel free to contact me, or even take a look at our UH West Oahu webpage where my contact information is located. And there you'll find out even more about how other careers are in need or value community health, nursing, medicine, research, biomedical fields, even the latest business field would benefit from having someone who's health related on their staff. Can you imagine if you had a small piece of community health or public health knowledge, what your career might look like post pandemic? I would say this is definitely a very lucrative field to get into, especially right now. So feel free to reach out to me at any time at the link maybe that's provided via our session today.
Thank you for that. Is there anything else that you would like to add in our last couple of minutes before we conclude our show today?
Oh, sure, Kathleen. I love to say that you're never too old, you're never too young to learn. Hopefully, you're just as excited as I am about being a lifetime learner. I still take classes every now and then. So I would love to encourage everyone in our state, much as like our President Lasner and Chancellor Maynette Benham have shared, that education is accessible to you. So please don't feel that it's not. We would love to get everyone the degrees they want to get at any of our campuses, especially UH West Oahu. So don't be afraid to reach out to someone. We're only a question and answer and even an email caller away.
Thank you again for being on the show today to talk about public health and community health. And we will wrap up the show. Thank you to Jay Fidel and the staff of ThinkTech Hawaii for making shows like this possible. We had Haley helping us out this afternoon, and we hope you tune in again in the next couple of weeks. So have a great afternoon. Aloha.